Hi everybody, thanks for joining us. My name is Nick Maple, and on behalf of the Refugee Law Initiative, it's my pleasure to welcome you all to this RLI and Recap special webinar entitled Accountability to Refugees During the COVID-19 Pandemic, Exploring the Humanitarian Response in Uganda and Bangladesh. I'll let our speakers properly introduce the project and the topic, but just to say, the seminar will be examining some research the RLI has been conducting via collaborations with the International Rescue Committee and Save the Children to assess the impact of COVID-19 pandemic on the humanitarian response and accountability to refugee populations in Uganda and Bangladesh. So the aims of the webinar are to unpack how these organizations' communication and accountability strategies have adapted to the challenges posed by the pandemic in these different contexts, but also to discuss the different approaches these organizations have adopted to keep serving affected populations within the restrictions imposed by lockdown regulations and new health risks to protect their beneficiaries and reach the most vulnerable. So to help us examine these issues, I'm joined by two of my colleagues at the RLI who have been working on the Recap project for the last 4 years, and I'll properly introduce each of them before they speak. In terms of format and housekeeping though, both Sarah and Diana will be speaking for around 15 to 20 minutes each, and then we should hopefully have plenty of time for a wider discussion with questions and comments from other participants in the session. As such, while the speakers are talking, please do have a think and pose your questions in the chat function, or alternatively, you're welcome to raise your virtual hand once we start the Q&A session. Finally, do please keep your microphones on mute and your videos off during the presentations. And also just to note that we're recording this session, and I believe a podcast will be available in the coming weeks on the RLI website. Okay, that's enough for me and the introduction. Let me turn to our two speakers. Our first speaker will be Dr. Sarah Singer. Sarah is a senior lecturer in refugee law at the Refugee Law Initiative and program director of the distance learning MA in refugee protection and forced migration studies run by the RLI. She is also, and obviously for the purpose of this webinar, she's the co-investigator of the 4-year funded Recap project, and as such has led research on accountability and protection in forced displacement contexts. After Sarah, our second speaker will be Dr. Diana Martin. Diana is a political geographer with an interest in responses to forced migration and the relationship between temporary and permanence in relation to forced displacement and state responses to forced displacement. And Diana is also a field and legal researcher on the Recap project. Again, I'll let them both explain more about their roles and the focuses of their presentation. So I'll hand it over now to you, Sarah, if that's okay. Thanks.
Thanks very much, Nick, for that introduction. And hello and welcome everyone to this webinar on accountability to refugees during the COVID-19 pandemic. As Nick mentioned, in this webinar, myself and my colleague Diana Martin will be presenting research from 2 case studies that we have conducted as part of the Recap project. The Recap project is a 4-year project funded by the Global Challenges Research Fund, which explores resilience and capacity strengthening in the face of humanitarian crises and epidemics. And in our research, we've been examining accountability to refugees and displaced populations and the protection of these people during crises. This is not accountability or responsibility of state or state-led agencies, but the humanitarian actors providing assistance and protection. And here we partnered with the International Rescue Committee, IRC, and Save the Children to explore their accountability strategies in the face of the COVID-19 pandemic. The research examines how these humanitarian organizations are and can best be accountable to those they serve. For example, their communications with and listening to the voices and feedback of affected populations, implementing these voices in their humanitarian programming, and the ways in which they can or may empower refugees and affected populations themselves. These two case studies are examples of how two prominent humanitarian organisations coped with the challenges posed by COVID-19 and adapted their working practices. And the research was conducted in the second half of 2020 and in early 2021. And we highlight both positives, but also gaps in their approaches and how these can be built on to strengthen practices going forward. I also think these case studies are quite interesting case studies themselves on conducting research in the context of COVID-19, and indeed in any context with restrictions on movement or interaction with affected populations. Our methodology is not perfect. Most importantly, for this rapidly realized research, it was difficult to include the voices of affected populations. However, we do hope that they serve as a useful basis to engage with discussions on research methodology in crisis contexts. I will now hand over to my colleague, Dr. Deanna Martin, who will introduce humanitarian accountability as a concept and practice and the first country case study. Over to you, Deanna.
Thank you, Sarah. Okay, so just to provide a little bit of background on humanitarian accountability, because humanitarian actors are obviously playing an important role in assisting populations affected by conflict and displacement and crisis. So we're talking about different types of accountability. One is upward accountability, which is the accountability to donors. And often this takes the form of financial accountability, ensuring the funding is well spent and is spent also as promised. Downward accountability towards affected populations. So it's about, as Sarah mentioned, it's about giving account to them and listening to them and address their needs. And so not assuming that programming we wish to develop is necessarily good for them. And then also sideways or also horizontal accountability, which is based on humanitarian staff and organizations interacting to each other to better provide service for affected population. So for to give a definition of accountability, I think one of the most cited is the Humanitarian Accountability Partnership definition, which describes accountability as, and I quote, the means through which power is used responsibly. It is a process of taking into account the views of and being held accountable by different stakeholders, and primarily the people affected by authority and power. So this means that also affected population and accountability to them is really stressed. And this is also promoted through a series of international initiatives, such as the co-humanitarian standards on quality and accountability. You can find the 9 commitments on the picture on the right of the screen, but also the Grand Bergen Participation Revolution. So humanitarian actors implementing this principle in general agree that accountability to affected population is paramount to have more effective, relevant and efficient and also timely and appropriate programming and humanitarian response. And this can be done in different ways, but one of the ways in which this is done is the setting up of feedback and complaint mechanisms through which communities can give humanitarian organization feedback on their programming or can raise any concern. So to introduce the Uganda case study, our Uganda case study is based on a collaboration with the International Rescue Committee. It originally aimed to evaluate how IRC Uganda implemented accountability to affected population principles and how it involved clients, they called them clients, in programmatic decision making. Through their strategy, the IRC committed to engage affected population in general in the design and the delivery of humanitarian assistance. But they also the IRC developed and implemented It's a client responsive programming framework through which it commits to collect, analyze, and respond to client feedback, and then to use clients' views to then adapt their programming. And the IRC also pledged to close the feedback loop, which means not only collecting feedback and analyzing feedback and incorporating into programming, but also telling communities how their feedback impacted on programming. The pandemic restrictions unfortunately kind of made us rethink the evaluation that we had to conduct. We were supposed to also be in touch with the contact refugee communities, engaging focus groups. This was not possible. So this means that our research question were revisited a little bit. So we did a study on how IRC engage affected population during the pandemic and how they managed to also protect them. It is based on a desk-based research of policies and practice of IRC and multiple remote interviews with 4 senior members of staff. I had 5 encounters and meetings with each of them. And obviously there are lots of limitations with this kind of methodology. This means that we could access only limited number of staff and was senior member staff and not field officers. But multiple encounter allowed me to go more in depth in understanding client responsiveness and how it's used by IRC. Unfortunately, the views from affected communities, we were not able to include them because of the obvious limitations of the pandemic. But we still hope that the study shed some light on the perhaps good practices, perhaps identifying gaps that can be addressed in the future. So Uganda, the first COVID case in Uganda was registered in March 2020. The government imposed restrictions and the national lockdown, which greatly impacted refugees and Ugandan citizens as well. COVID imposed health-related challenges, but there were also economic and social consequences because of the ban on use of public transport and on movements, which put livelihood also at risk. And moreover, for refugees, there was a cut to 30% on cash and food assistance because of the lack of funding. So refugee population particularly suffered from these cuts. And the challenge from humanitarian organization was to keep going with their ordinary programming, but also protect staff and refugee communities from the spread of the virus. So even though refugee settlements in Uganda are not particularly crowded, there may be overcrowding in service points. So the IRC had to decongest offices, health facilities, and other service points. The number of staff, activities, and clients accessing facilities was therefore considerably reduced. Minimal numbers of staff were kept to serving points for clients to provide feedback, but also for staff to disseminate information about COVID and prevention. Health services were adjusted and focused on life-saving activities. And to avoid overcrowding, IRC kept health centers open for longer hours. Staff, though, had to work longer shifts. But also the activities for other programming was affected. So activities in women and girls centers were put on hold, and centers were closed for about a month. Only essential staff for case management related to SGBV response was kept in the women and girls centers. But restriction of movement also meant that clients were no longer able to report their needs in person. So the ban on gatherings of more than 5 people really impacted on the monitoring and protection of protection issues. So before the pandemic, these were reported and monitored through meetings at the women and girls centers. And during the pandemic, listening sessions could not be held for 3 months. So this has greatly impacted on protection. So in January, all the channels, apart from community meetings and focus group discussions, were kept open. The IRC undertook safety audits and client satisfaction surveys remotely, and used the phone to communicate with clients, but also community leaders and community-based volunteers. But inevitably, with the pandemic, risk increased for certain groups. So for instance, the number of teenage pregnancies for 14 to 19 years old sadly increased. And the announced level of vulnerability and risk of violence for women and girls was identified only through remote safety audits and interviews with some clients and community leaders. But inevitably, there's a chance that many cases have been also missed because of the pandemic. So risk communication was really key, and IRC invested in channels that could support electronic and social distancing feedback mechanisms. Hybrid approaches included some degree of socially distanced in-person communication, and this helped to minimize risk and allowed greater participation and interaction. So one of the most effective ways to engage clients during the pandemic and inform them about changes in program delivery or risk related to COVID was, for instance, through the refugee welfare committees, or also the village health teams, who were provided with megaphones to disseminate information. Home visits were also conducted by village health teams and community-based volunteers so that they could share information with clients, but also collect their feedback. And community leaders were also provided with airtime to communicate with IRC staff in the eventuality they needed to report any protection issue or provide any feedback on programming. To communicate messages on prevention, IRC also used posters at service points, radio talk show, and Boda Boda broadcasts. So the Boda Boda is the Uganda motorcycle. So for this broadcast, Boda Boda riders drove slowly through the settlements playing a pre-recorded message. They have speakers on the motorcycle, as you can see in the picture. So they play a pre-recorded message, and they also stopped at key service points so that people could properly listen to the message and provide also feedback that the riders then were referring to the IRC. Communication was in general effective. Also, this came out from our conversations with IRC staff. Community seems to change their practice. So they were using more soap and water. They were practicing social distancing. But IRC staff also admitted that there was inevitably a problem of both access and relevance. So not everyone was able to access information at the same time. And also for those who access information, then we really need to ask ourselves, was that relevant? Was it, can people actually wear masks? Can they social distance, especially for maybe people with disability who rely heavily on others to help them? So this was really a challenge for IRC, for obviously affected population and other humanitarian organizations on how to respond to this. But the pandemic affected people in different ways, and a client responsive approach and an accountable approach can help to deliver timely and relevant programming. So, or at least attempt to. So by maintaining and investing on two-way communications, the IRC was able to, for instance, detect and tackle the additional risk and challenges that the pandemic has posed. and whenever possible, change programming according to the feedback received from the communities. Just to give an example, the PROL team, so the Protection and Rule of Law team, decided to provide cash instead of material support such as food and clothing. This was requested by affected populations, so by refugees themselves, and they actually proposed the IRC to use mobile money transfer to get the cash. But particularly important was the rumor tracking initiative. So feedback from clients was crucial to detect potential quality issues with information sharing activities. And the rumor tracking initiative helped detect issues of access, so those who didn't access information straight away, but also rumors on coronavirus and address communities' understanding of risk. So IRC tracked misinformation, developed, recorded, and disseminated counter messages to demystify rumors. And this was possible thanks to their work with community structures, but also the Boda Boda broadcast and the radio. So what are the lessons learned? I mean, the response wasn't perfect. There were challenges, but also the pandemic kind of made humanitarian organizations reflect on their practices even more. In terms of challenges, the ability of staff to implement programming and communicate with affected population was affected by the lockdown restrictions on in-person communication and the ban on gatherings. And this also affecting clients' ability to report any concern. So in order to maintain communication with clients open, beyond the user community structures, the IRC had to rely more on other mechanisms such as a hotline. But this wasn't a solution for everyone. If we think about women experiences SGBV, well, they may not be in a safe place to simply call the hotline. So there were definitely gaps. And also both clients and staff experience fears and anxiety. So clients may have left the settlements in certain cases, so it was difficult for staff to then follow up on the case management, but also staff ability to support communities was impacted because they also had fears of being infected, their workload increased, and some may not have received additional support, also psychological support that maybe was needed. In terms of the opportunity, the study showed that listening and collecting clients' feedback and ideas can improve service delivery, especially because of the changing needs during the pandemic. And I think just because people prefer in-person communication, it does not mean the remote engagement cannot happen. So structure to remotely reach out to communities have also been consolidated, as during the pandemic, a centralized database containing information on, for instance, refugee representative with names and contact details was created. So the database was created. Well, this cannot substitute in-person communication in the future, but the centralized database can now offer additional channels to reach communities faster and possibly enhance their participation in programming. And the pandemic really helped to learn more about how messages are received, how conversations happen between humanitarian organization and the affected community. The IRC had the chance to better understand where the communication was breaking, where it wasn't accessed, and when it was misinterpreted. So the rumor tracking initiative made the IRC realize that it's not only important to convey the message, but also to ensure that the message is understood and interpreted correctly by communities. And staff also realized that empowering communities is possible. Staff on the ground was reduced. The IRC and other humanitarian organizations had to think differently about programming. So they were able to train community-based volunteers on case management for protection services. And during the pandemic, volunteers demonstrated their ability to sustain service provision and assistance. So when the situation normalizes, the involvement of community structure should be maintained and enhanced to better reach also everyone. So just some final recommendations that we thought were key in terms of lessons learned during the pandemic. I think it's important that humanitarian organizations invest in community structure more and also on channels for remote communication. The pandemic has shown that while in-person communication is generally preferred by clients, remote communication can be used and increased in ordinary times too, to speed up communications with communities, for instance, and when dealing with clients who may not have access to phones or internet, or when dealing with sensitive matters and protection issues, community leaders and volunteers can perhaps assist in the delivery of services, collection of feedback, and assessment of needs. And ensure the communication with clients is effective is really key. Need to collect feedback to assess if the message has reached the intended audience, if the intended audience has interpreted the message correctly and has the ability to act upon it. And it's important that humanitarian organizations make an effort to consult clients before new proposals on programming is submitted. So remote communication can also help to make communication faster on this. And I think a last point, but I think something that was really important is that support for staff needs to be maintained. The implementation of accountability to affected population can be ensured also if staff well-being is also looked after. So we now present, we can move to the Bangladesh case study. So Sarah will present our Bangladesh case study on the implementation of AAP.
Thank you very much, Deanna. Just give me a moment, everyone, while I get my PowerPoint up. And then I will proceed to introduce the second case study. As Deanna mentioned, it is our case study in collaboration with Save the Children Bangladesh. I hope you can all see that okay. So this case study evaluates the impact of the COVID-19 emergency on Save the Children's use of feedback from adults and children in Bangladesh. During the early months of the pandemic period, government lockdowns and restrictions on movement and the continuance of only critical Save the Children programs significantly limited the range of ways that Save the Children could engage with children and their families. So this study focuses primarily on the period of April to September of 2020, when the Bangladesh government mandated lockdown in most affected areas. In terms of the scope, the study focuses on Save the Children's Rohingya response in Cox's Bazar. Save the Children is among the largest organisations providing humanitarian assistance there. And in Cox's Bazar, at the best of time, the humanitarian response faces quite considerable contextual challenges in engaging with affected children and young people and their families. And this includes a lack of literacy among the Rohingya population and the dominance of Marji leaders as Rohingya spokespersons. On top of the COVID-19 government restrictions, Save the Children also has to contend with specific government restrictions for refugees. So Rohingya refugees are, for example, prohibited from engaging in paid employment. And serving as a useful contrast to the emergency Rohingya response, we also focused on two development programs, the Suchana project and the Shishuda Jono sponsorship program. The research methods employed in this study include 29 remote key informant interviews with Save the Children staff and with partner staff, in both the emergency response and development programs, an online staff survey, and a review of Save the Children's accountability data. The study is limited by the remote data collection approach, which was enforced by the COVID-19 restrictions in place. And most importantly, this meant we had to cancel our field visits, and it wasn't possible to include the insights of children and their families. So the study is limited, and we recognise this, but we hope this research nevertheless serves as a useful insight into Save the Children's practices during this difficult period. So what did we find? Well, with the onset of the pandemic in Bangladesh in early 2020, Save the Children produced guidance for adapting their feedback and reporting channels, their ways of communicating with refugees and affected populations, aiming to mitigate the viral spread whilst continuing to collect and process feedback to the extent that it was possible. The core feedback and reporting channels used across Save the Children before the COVID-19 pandemic were the organisation's toll-free hotline, the use of help desks and feedback complaint boxes, and focus group discussions with community members and with children. But also a rich variety of 16 different channels were newly being promoted in different parts of the organisation. The COVID-19 pandemic obviously hampered the development of these new pilots and also significantly limited the range of feedback and reporting channels that Save the Children could continue to use, particularly during the height of the pandemic. So Save the Children retained its low-risk remote feedback channels, so the hotline and phone communications. And the continuing critical programs also retained limited face-to-face feedback channels, mainly exit interviews or surveys or help desks. But the limited feedback channels available significantly impacted the ability of Save the Children to receive feedback from and communicate with children and their families. In the early months of the pandemic, there were no child-friendly feedback channels in operation, a point that I'll discuss in more detail later. However, perhaps to counterbalance this, a number of both Save the Children staff and partner staff remarked on how feedback and reporting had become more proactive in nature on their part during the pandemic. So field staff noted that they had become more used to and skilled at using proactive channels such as one-to-one telephone interviews, and managers had also become better at reaching out to community leaders, to peer group leaders, and to volunteers in their pursuit of feedback. Another key development attested to by partner staff and Save the Children staff was the increased recruitment and use of community volunteers. Particularly in the Rohingya response, increased working with community volunteers became a really important way for Save the Children to communicate with and hear from children and their families. These volunteers were able to visit households in place of staff, collect phone contact numbers, and conduct accountability activities under the direction of Save the Children accountability staff, where Save the Children staff were not able to go into the field. However, the feedback received through community volunteers wasn't systematically recorded, so it's difficult to determine the impact of volunteers on feedback in practice during this period. Beyond the recruitment of volunteers, the value of empowering and harnessing community groups to source feedback was also noted by a number of staff. At the same time, volunteers were not always formally acknowledged as having collected feedback themselves, and they tended to be perceived more as like a link or a tool used by frontline staff to connect with communities. Feedback received through volunteers was not regularly formally recorded, and it does not appear as a distinct category in any of the accountability reporting carried out by the Cox's Bazar area or the country offices. In future, we would suggest that feedback received through volunteers and community groups is systematically recorded as such, and Save the Children could also consider whether the inclusion of volunteers in programmatic decision-making could be used as a way to enhance the inclusion of affected populations in decision-making processes. Equally, given the increased prominence of community volunteers in collecting feedback, it's really important to give attention to the training of volunteers on handing feedback, including feedback of a sensitive nature. Now, I mentioned earlier the difficulties engaging with specific groups, particularly children, during the onset of the COVID pandemic. Save the Children's approach to the risks of engaging children in face-to-face feedback channels during the early months of the pandemic was explicit, and direct contact between staff and children was ruled out. So feedback from children of both genders, unsurprisingly, decreased dramatically. Key among this is the obstacles faced by children in accessing remote feedback channels, such as the hotline and phone communications. And particularly in the Rohingya response, children were not used to speaking to staff over the phone, and they found remote data collections particularly difficult, including difficulties in accessing phones and communication devices. Women and young girls were also excluded from engaging with the majority male-led community volunteers. Commonly without their own mobile phones, they were often required to wait for the man of the household to be home in the evening to communicate with Save the Children, and therefore they had to reach Save the Children support out of normal office hours. And many respondents also felt that persons with disabilities and the elderly were disempowered from providing feedback when their options were reduced to remote channels. But without disaggregated data from Save the Children, it's not possible to know the extent of this in practice. In the development contexts, remote living locations, often inhabited by very poor communities, also made telephone communications particularly challenging. So overall, to enable Save the Children to get a better insight into reaching these hard to reach groups and responding to feedback from such people, we suggest that they have detailed disaggregation of feedback data, particularly for the elderly and those with disabilities. And this will help with the analysis of feedback and the appropriateness of action in response to feedback. On a positive note, some peer-to-peer sessions did take place in the Cox's Bazar camps, and these were conducted remotely. And these peer education programs use community volunteers who were themselves adolescents to run teaching sessions. The volunteers were trained and supported by Save the Children staff in doing so, and facilitated the sessions in a virus-safe way. And this is a really great practice which could be capitalised on in the future. From October 2020 onwards, a small number of face-to-face child-friendly feedback sessions were also resumed by Save the Children directly in a number of the Cox's Bazar camps, such as small focus group discussions. And in the development context, we also saw some positive initiatives. A social media initiative was established to replace the previous face-to-face children's groups on areas such as child advocacy. And again, here we saw some peer engagement and support, because young people without access to online communication devices themselves were able to link up with and engage through peers who did. So we've outlined some of the key challenges communicating with and receiving feedback, but what do staff do once they receive such feedback? As Deanna mentioned, this is a really crucial aspect of the accountability cycle, both in ordinary and in pandemic times. And key to supporting this, the Bangladesh country office team is currently rolling out an online feedback and response system to be shared across the country organisation. And this is intended to serve as an effective mechanism for recording and responding to accountability feedback. And it replaces the somewhat ad hoc methods and mechanisms that were in place previously. So the benefits of using an online system are multiple. It provides real-time accountability information for quicker decision-making and action in response to feedback. It also improves transparency in reporting, and it provides staff with an evidence base to support their own programming and implementation. However, access to the system is currently limited to Save the Children staff only. And considering the reliance on partner staff and volunteers for data collection during the pandemic, we would suggest that now is a particularly good time to provide orientation sessions for partner staff and for volunteers in using this system. And Save the Children might also consider whether partner staff could be trained and provided access to frontline data for submitting feedback themselves. So in conclusion, in future crises or new waves of the COVID-19 pandemic, Save the Children does now have pre-positioned feedback and reporting channels to engage with children and communities. And outside of the pandemic, there is learning which is applicable to normal contexts of Save the Children's work as well. Some key recommendations for the future coming out of this research are, firstly, to invest in the community and volunteer-based feedback and reporting channels. This might include consulting volunteers more often about changes to feedback channels, training them in feedback collection and safeguarding, and giving thought to a more systematic approach to their recruitment and role with an eye to inclusivity and gender balance. We also suggest that Save the Children put in place processes to document informal feedback, including those collected by community volunteers, as a discrete feedback and reporting channel. We suggest that Save the Children capitalise on the new culture among staff by focusing on building skills for proactive feedback channels. This might include learning sessions and trainings for both internal staff and partner staff, both as a way to source feedback, but also to cascade messages to the broader community. We think that Save the Children should continue to engage with children through the peer-to-peer channels which have been developed. And these peer-to-peer channels could be adapted and expanded as opportunities to collect feedback as well. With so few feedback and reporting channels for children up and running during those initial months of the pandemic, it's really vital that Save the Children find better ways to engage children during future crises. This research showed some very good practice and new suggestions for technological innovation, but it's also important to consider the limitations of remote communications and online technology. Access to technology is a continual challenge in the Rohingya response, and women and young girls and other hard to reach groups, and those with disabilities in particular, often face particular challenges accessing technology. Some staff suggestions to address this include providing smartphones to volunteers or to women's leaders or groups so that women are less reliant on men, and radio communications and community-based centres or hubs where volunteers and other feedback channels could be accessed. Save the Children could also consider extending its working hours in order to reach women via phone. Save the Children should also make the most of the online feedback system that's being developed by considering whether partner staff should also be trained and provided access for the purpose of submitting feedback, and perhaps additionally contribute to the management and analysis of feedback itself. And finally, including vulnerabilities and disability in feedback recording, in data analysis, and reporting would enable Save the Children to understand which feedback channels are most accessible or not to hard to reach groups and the particular challenges faced by these groups. So that was an overview of the Bangladesh country case study. And having presented or having looked at both the Uganda context and the Bangladesh context, we have some lessons learned, I think, from both case studies and thoughts about the ways in which humanitarian organisations more broadly could approach their accountability activities in future crises or indeed in normal times. So firstly, as shown through both case studies, the limited feedback channels available significantly impacted the ability of IRC and Save the Children to receive feedback from and communicate with affected populations. The organisations did or could use technology to disseminate information better. The Boda Boda broadcasts in Uganda and the Social Media Initiative in Bangladesh are good examples of this. The research also showed good practice and new suggestions for technological innovation. But it's important to consider the limitations of remote communications and online technology. Not everyone has access to such technology or is comfortable in using it. And certain groups such as young children or the elderly or those in remote locations might have particular difficulties accessing and using remote feedback channels. Both case studies revealed increased work with and through community volunteers and leaders. It's really important when we think about this increased engagement that humanitarian organisations are mindful that community structures are representative of the refugee population and include often underrepresented groups and a gender balance to the extent possible. And humanitarian organisations could also consider investing more in these volunteers and community leaders. IRC provided community leaders with phones and radio airtime, and Save the Children could also consider ways to support and enhance the roles of volunteers and community groups going forward. And finally, proactively seeking feedback in situations of emergency was really crucial to both organisations in understanding the changing needs of affected populations, especially when feedback routes were limited. And we hope that IRC, Save the Children, and indeed humanitarian organisations more broadly can capitalise on this and strengthen their organisational cultures and their accountability to the communities that they serve. Thank you.
Thanks, Sarah, and thanks, Diana, for an excellent presentation. It was particularly interesting how a number of points came across in both case studies around sort of, particularly I found interesting like the idea of windows opportunity going forward potentially, but at the same time, you know, the inherent risks of seeing something as a unique opportunity, particularly around volunteering. But perhaps we can hopefully get into that in the questions. I see some questions have already come in, so I won't take up any more time. I would, Diana, in relation to the questions on rumour tracking, I would, if I can be a bit cheeky and just add on, I wondered with the work that we've been doing in South Africa around these issues, that also an issue of trust comes up around who is giving the information, how is that communication passed on, so what kind of role does trust play in all that? And I wondered if that's come up in yours or Sarah's as well. Yeah, if you don't mind, if you could start us off in relation to the rumour tracking. Thanks.
Thank you, Nick, and thank you for the questions posed on the chat and everyone who commented so far. And I think I can also, in responding to this, I can also address Mr. Robert Okello comments, which I totally agree with, by the way. So I will unpack this a little bit more, so the rumour tracking, and then perhaps link this issue of trust with Mr. Okello's comment. Basically, the rumour tracking worked. So as I mentioned, for instance, Boda Boda riders went through the refugee settlements, and the rumour tracking was basically IRC staff engaging with community leaders, community volunteers, and village health teams after these messages have been shared. Could be messages on how to protect, for community, how to protect themselves. So in this communication, basically IRC staff try to understand if everyone in their specific areas received a message, and or what was the community thinking in terms of coronavirus and what was happening. So the rumour tracking was really establishing, again, this channel of communication between humanitarian organization and community leaders and volunteers. So it turned out that through this communication, it turns out that, for instance, certain areas were missed by the riders, because really they were just driving around the same area, so they missed certain spots. And thanks to this, then IRC engaged the rider and say, okay, you have to also cover that particular area. Or also, I think there was misinformation about COVID. I mean, there were certain areas in which specific communities were downplaying the role of the virus. They were thinking it was nothing serious. So the IRC strategy was then taking this feedback from community leaders and basically creating targeted messages for that particular community, and then having another Buddha broadcast going around in that area to actually explain the seriousness of the disease and the virus. Or also, if there were beliefs on how to cure coronavirus that were not correct, again, there were specific messages that again went around in those specific areas to demystify these rumors. And in terms of trust, I think that, and this is why I wanted to link it with Mr. Okello's comment, is actually that unfortunately we were not able to talk to affected communities, to refugees or host communities living in refugee hosting areas, and this was really a major limitation of this research. But if we think about it, even humanitarian organizations themselves couldn't engage refugees as much as they wanted because of the restrictions. Now, the Uganda case study was undertaken in summer 2020, so restrictions were still very much in place. And yeah, it would have been interesting to understand this point of trust from actually from the affected population. I mean, if we ask humanitarian organizations, they say we've done everything to increase the trust, and they may say we've done this, so the trust in our work has increased, but there's no way of verifying the information. So in this specific case, I'm not able to respond to this point.
Thanks, Anna. I was wondering, Sarah, if this sort of issue came across in your work, particularly around this sort of ideas, but also working with the volunteers, whether that was something that came.
Yeah, I think the kind of the rumor quashing and the importance of messaging and effective messaging also came through really strongly in the Bangladesh context as well. So particularly in the early months of the pandemic, there was a lot of mistrust of health support being provided by Save the Children and other organizations. And Save the Children were trying to establish a new unit for severe respiratory treatment, for example, and they got lots of negative feedback from the community. Effectively, the community were concerned that health facilities in general, and particularly this one, were actually going to increase the spread of the virus. So they had to do a complete overhaul of their risk messaging communication system, and volunteers were really heavily involved in that. And it was about cascading really simple messages about what COVID is, how it can be treated, and debunking some of the myths or rumors that had emerged around it. And I think that was a really great example of how Save the Children, listening to the concerns of the population, enabled them to revise their risk messaging strategy and put in place a more effective process. And they did see attendance numbers at health centres and the level of negative feedback around this new respiratory unit go up and down, sort of respectively.
Thanks. Just as a quick follow-up, I was the research conducted before the vaccine was any of the vaccines was rolled out? So I wondered if there was any sort of observations around vaccine hesitancy or no. But if not, I'll move on to the next question. Well, I don't know if other people have any other questions. Please do post them. I had a question for Sarah, if no one has any at the moment, if that's okay. Yeah, I would just be interested to know what types of feedback was being received in Bangladesh. What were the particular difficulties children or the families were facing during the pandemic? I asked this because looking at quite a lot of the research that's come out in the last year and a half, I do think this is a population that is, been missing by quite a lot of the research. So I think that'd be best.
Thanks, Nick. Well, I would stress, as I mentioned in my presentation, the amount of feedback received directly from young children went down massively during the pandemic period because there simply weren't child-friendly feedback mechanisms in operation. But there was still a large amount of feedback coming through from the Rohingya community more broadly. And as you would expect, a lot of that, particularly in those initial months of the pandemic, focused around health concerns. So it was about the provision of masks, of soap, of hand sanitizer, etc., those kind of precautionary things. There were lots of calls for information sessions so that the community could learn and understand more about the virus itself. I think particularly pertinent to children, something that unfortunately came through in some of the items of children's feedback that came through was, as they were confined in their homes a lot more and the child-friendly spaces weren't open anymore and educational facilities weren't open, they obviously missed that opportunity to engage and interact with others and be outside of the house. But there were also reports of increased violence against children during that time period as well. So that's a really kind of is a very, very sad consequence of the pandemic and the lockdown restrictions that were imposed. As you get further on through the months of the pandemic, the calls are much more for when are normal programming and services going to be resumed, when are the child-friendly spaces going to reopen, when can we resume education for the children. And I think throughout all of this, there were concerns about food stability and livelihoods, as that was cut and decreased dramatically. So a lot of requests for support, but also some reports of, you know, particular challenges.
Thank you. We've only got a few more minutes, so if anyone does have any questions, please shout. Deanna, I wondered if I would just come to you, and Sarah jump in if this is something you'd like to add. But I was interested in, like I said, in both your presentations, there seemed to be this sort of like windows of opportunity, you know, through the pandemic to some of the programming was slightly changed, and potentially that might carry on in the future post COVID-19. I wondered if you could speak a little bit more about that. Like, I know you mentioned the cash-based approaches, and then Sarah mentioned this idea of, you know, training people within the community to potentially implement programming, which again, in the South African context, it was really interesting with UNHCR and Red Cross doing quite a lot of that. I wondered, is that just something that you see as going forward and like purely positive, or have you, you know, thought of any of the downsides to potentially that sort of change in programming? I hope that makes sense.
Sorry, your question was on Uganda's case study was about cash interventions.
It's more about, like, do you see shifts in approaches in the programming during COVID going forward as an improvement for programming post COVID-19, and just any other reflections on that would be great.
Yeah, we haven't done specifically a study looking at food or cash. I mean, we've done actually a parallel study at some point, but for not conducted by myself. I think that really, I think that from my understanding, humanitarian organizations try to move from food distribution to cash distribution because and try to incentivize that because obviously to avoid overcrowding at food distribution points. It was also through mobile money transfer. You don't have to get in touch with people. So that was the why some shifted to cash. On the other hand, though, if you have cash, but markets are closed, or there is the ban on transport, how do you go to the market to actually spend the money to get the food? So I think that there's incredible challenges that refugee community faced, and also humanitarian organization in providing the assistance. I think that the best approach, despite of what everyone may think, is that actually ask each and everyone what do you prefer. So I think that that's bearing that's essential element of accountability in mind, and asking what is best for the communities, and allowing them to shift as the conditions shift. So if they prefer something else at some point in time, they should be able to get that.
Yeah, I think in terms of change of organizational approach and culture, something that comes through really strongly for me from the Bangladesh case study is the importance of working with partner staff for implementing partners and volunteers and community groups, and properly acknowledging the contributions that those different actors play in Save the Children's work, because Save the Children was effectively, to a large extent, it was quite blind during particularly these initial months of the pandemic, and it relied so strongly on these different structures. And I think it highlighted the gaps in the responsibilities that were accorded to those different actors, and their abilities, for example, to use, the different feedback and reporting systems, but also to have their work properly acknowledged and recorded is really valuable in itself. So I hope that a closer working with different partners is something that's going to embed itself more going forward. So I mentioned right at the beginning of the presentation that when the pandemic hit, Save the Children, updated all of its guidance on the reporting and feedback channels that it would have in operation. And it did this in a really top-down way. It didn't consult partners. It didn't make any attempts to consult the community or even community volunteers or leaders at all. And there were clear difficulties. There were no child-friendly mechanisms in place at all during those initial months. So I hope that going forward there would be a more collaborative approach to serving those communities.
Great, thanks, folks. I think we've run out of time, but yeah, thank you again both for such fascinating talks. And just to say, thanks again. It's been really interesting to see how these projects have developed and produced some really important findings. So let me end the seminar by saying thank you to all of you for joining us, my colleagues at RLI who have helped set up this event, and of course, most importantly, our two speakers. Just before you go, I just wanted to flag two other events coming up next week. One on Monday, which is entitled Identity, Rights and Internal Displacement, which is being run by the Middle East Research Network on internal displacement. And then on Wednesday, the 8th, we have our 5th session, I think it's the 5th, of this year's International Refugee Law Seminar Series, which is entitled Moving the Goalposts, Yet Again, Access to Justice in the UK Asylum System. And I think one of the speakers there is Gillian Triggs, the Assistant High Commissioner for Protection at UNHCR, of course, amongst all the other excellent speakers. But more information on both those events and how to book can be found on our website. I think that's it. So thanks again, all of you. And hope to see you all at our next event. Thanks. Bye.